Serious doctors of Reddit, what are the red flags that people should look out for in order to avoid an incompetent or bad doctor? If they ask the right questions, but don't pay attention to the replies. A lot of lazy doctors just have a script they work through, and so long as your replies don't completely throw them off, they just make their way through it without picking up on things like uncertainty when answering, or nervousness or crossed wires. Also, if you are prescribed something, or booked in for a procedure and so on, you should at least understand the basics of why you need it/what it's for. If you go to the doctor not knowing what's wrong, and leave still not having a clue what it could be, but with a prescription or a referral, find another doctor who'll spend a few minutes actually informing you. Sometimes that might mean telling you they don't know what it is, but that's a lot better than you leaving thinking it must be totally fine as the doctor didn't say anything other than come back in a few days if you aren't feeling better. I've totally felt like doctors did this before. They'll ask how I'm feeling, then just look at their computer or paperwork and go yeah, at totally unnatural times, like in the middle of my clauses or what I'm saying, and then just look up and start nodding like a news reporter. And then I finish, and they go well okay let's have a look at you, or whatever, as if everything I had said at first was meaningless. As a dentist, I have seen patients freak out when you tell them their tooth can't be saved. In few cases, dentists are either lazy or want to make more money by extracting teeth and then replacing them. I'm a specialist, but I think this applies to both general practitioners and specialists. Disclaimer, as others in the thread have mentioned with their posts, I've known both really good and really bad doctors who would fit these criteria. Incompetent, a doctor who never says I don't know. Medicine is insanely complex, and a good physician should always be using resources, textbooks, journals, Dr. Google, etc. as a refresher and to keep themselves up to date. This generally cannot be done in the exam room. If you show up to your doctor's office with new complaints, don't always expect an answer/solution immediately, unless your problem is really straightforward. Part of this may be the need for labs/imaging, but part is just giving the physician time to digest what you told them and plan what to do about it. Saying I don't know doesn't make them incompetent, but just the reverse. At least they know when they are out of their league or are being careful with your health. If they always know the answer, and especially if they are defensive with any questions, they are probably trying to hide their incompetence. But ordering complex tests for every little problem, especially if they have the machine in their office and can get it done the day you show up. Sure, this sounds convenient, but too often the doctor or the doctor's group owns the machine and make a little extra money by getting you to use their equipment, labs probably excluded. I would emphasize this even more strongly if you are there for a checkup and a bunch of tests are ordered unexpectedly. Personal story, a healthy young adult family member moved cities and made an appointment with a new doctor only to get her birth control refilled. Yet after the physical exam she got a heart ultrasound in the office, among multiple other tests. The ultrasound is not a routine test, probably costs north of $1,000, and came back completely normal. The clinic note only says the normal heart sounds were not well heard, not an indication for that test. Maybe had this person been elderly and never had medical care before I could understand, but this is a young individual with regular medical care. Can I prove any malfeasance? No, but that doctor's behavior does not give me confidence that they had my family member's best interest at heart. More equals better. A doctor who doesn't have any empathy for your situation and just wants to treat the medical bit and get rid of you. As a patient you should not be treated like a case out of a textbook. A good doctor will ask you how you are coping at home, what your biggest concerns are, and they should try to put you in touch with odd/social services/charities advocacy groups to try and improve your quality of life as a whole. Someone who uses this kind of holistic approach is someone you want as a doctor. If they distance themselves from the medical community, claim to be persecuted due to their methods, or that they are a maverick with a unique treatment, this is a massive red flag that they are the outlier among evidence-based specialists and potentially dangerous. Probably the best current example is Stanislaw Berzinski. Medicine is a science and they are doing it wrong. 1. When they ignore what you say, or fail to take an accurate history. This is when misdiagnoses tend to occur. 2. When they are overtly prejudiced regarding race, gender or disability, this can impact badly on your treatment. Unfortunately, I don't think there's a simple way for people without a medical background to evaluate the competence of their doctor. We get credited with cures unrelated to treatment and blamed for misfortunes that could not have been reasonably avoided. Patient satisfaction has far more to do with a doctor's interpersonal skills than their clinical acumen. I think the biggest red flag is if your doctor acts like a dick to you. Doctors are people too, and they come in all varieties. If you meet a doctor and he/she is a jerk, never go back to them. There are plenty of doctors out there, and you can find one with empathy who makes you feel heard and respected. Don't let them talk down to you. Your feelings and concerns are valid regardless of what anyone else tells you, and you deserve to find a doctor who is willing to be there for you. Ask for a second opinion, ask for a referral, or ask to be scheduled with a different doctor next time. If you feel like your needs were not addressed, ask for short follow-up, 1 to 2 weeks. If you go home and feel worse, call in, ask for help. They may send you to the ER for $1 million workup, but that may be what you need. Scans, stat lab work. Don't settle. You may be the patient, but you can still be in control. TL. Doctor, there is never a reason for another human being to treat you like dirt. If your doctor does that, find a new one. I've been going to the same family doctor my whole life and never had anything medically wrong with me until recently. I told her what's wrong, and she gave some suggestions and did tests and said I was fine. I come back 2 or 3 times and try to run some more tests saying something is seriously wrong with me, and now she's saying things like, well, if I get you an appointment here for this specialist and there's nothing wrong, then I'm going to look like an idiot for referring you. And what do you think you should do about it then? Also, she said it might be all in my head. Now I'm sitting here trying to find a new doctor. Most people are talking about doctors' bedside manner, which is important for comfort, but isn't a great metric for actual skill or medical knowledge. Here are things you should actually look for in a doctor. Do they teach? Teaching residents and/or med students means they are constantly forced to examine their practices and ensure they're using state-of-the-art techniques. Does their staff, receptionists, nurses, etc., seem to have their act together? These people are an important part of treatment and further reflect the capability and mental focus of the doctor. After hearing your symptoms, do 3 ask questions? If so, do they seem like weird, random questions? If you answered yes to both, that's a good sign. It means the doctor has come up with a mental list of possible diagnoses and is trying to narrow it down, as opposed to just immediately declaring it to be the most obvious. Bedside manner is an important aspect of treatment for the sake of comfort, and is the easiest criteria for patients to judge their doctors by, but there are a number of other factors that play in. Look at Dr. Townshend from season 2 of Scrubs. Super popular and friendly doctor who everyone loves, yet he gets fired. Why? Because he let himself fall behind and was at the end of the day a really crappy doctor. I'm a doctor, 55 plus years old, and in some specialty. Allow me to spill a few beans. Maybe it benefits some. First red flag. His/her appearance and demeanor. If he/she has a disheveled appearance, seems completely out of place, with poor personal hygiene, it is a red flag. Do differentiate between an overworked doc with a busy night and one I mentioned though. Second red flag. Any who uses curse words, was not listening your complaints, gets sarcastic about your usage of terms or wording, walk away. Third red flag. One who prescribes too quickly even as you have not finished. Fourth red flag. Any who does not examine you personally. Non-touch technique does not work for your benefit. Can assure you of that. Fifth red flag. Did he/she order unnecessary tests, sought opinions from other specialists, and could not offer a rational reason, advise you for an admission for investigations, even though your condition does not warrant an admission, just for the given reason? Ask him about his medical school, internship, and residency. Some places train better and accept the very best. A few things that come to mind, based on knowing which of my colleagues is incompetent. 1. Prescribing you narcotics rather than exploring why you have pain. 2. Ordering imaging, but not able to give you some idea of what they are looking for, even if it's just ruling out X or Y. 3 ordering uncommon or expensive labs without being able to explain what a positive or negative result would change in their management. 4 prescribing an expensive drug without being able to explain the benefits over an older or cheaper generic alternative. 5 not performing even a focused physical examination. Thanks for watching. Like, comment, and subscribe.